Diabetes is a completely manageable disease, and although it's overwhelming at first to a client to get that news that their cat or dog is diabetic, I play a huge role in trying to assuage their fears. People do feel overwhelmed when they get this diagnosis, but it is treatable.
One of the main recommendations that we have for all diabetic patients nowadays is in-home glucose monitoring. Clients are happy that they have some more control and more input and are more involved with their pet's care. We work as a team together. They obtain the glucose levels and the curves, and they forward that information to us always, and we translate into that as far as changing the insulin levels. They could be doing better if we actually knew what their glucose readings were on a regular average given day. Doing that in the hospital isn't always as accurate because of the stress of the pet and therefore the elevation in blood glucose levels, but that's really taken out of the equation with doing in-home glucose monitoring. I see that those patients that have their glucose monitored at home, they actually have their glucose checked much more frequently by pet owners because it's easy with the flexibility to be able to do this on any day they like, and also the cost is much less than if we do the glucose curves in-house.
I do go over how to report the results to the doctor. I assist with gathering that information, but the doctor is the one that reviews the results of an at-home glucose curve. The method that we're using is having the client gather the information over a 12-hour period, put that in a format that we recommend, and then emailing it straight to the hospital.
As pet owners, we have busy lives. And so therefore, just because they seem to be doing okay doesn't mean they're doing well. And to make your patients as well as possible, having better regulation with the AlphaTRAK 2 and in-home glucose monitoring is ideal.
There are handouts, there are little booklets and whatnot, so they really do get sent home with a lot of information as well. So if they don't truly understand something or they miss something when we were going over it, there's all that material to reiterate it. It is rewarding to see somebody come in and they're doing well and they're monitoring their pets at home, and we have a pet that comes in and they're happy and they're healthy and they're wagging their tails, and you know they're on insulin every day, but they're happy and they're healthy, and the clients are comfortable with this.
It's a lot easier than you think. Your pets are a lot more resilient. They understand over time that this is actually helping them to make them feel better.